Welcome back. We have Dr. Harpreet Lotay returning to the show from Sona MD. Great to have you back.
It's always great to be here, Susan.
Yeah, we've got some interesting stuff today. We're talking a little bit about full face rejuvenation and individualized treatments that might work well for some people better than others.
Yeah, absolutely. So what I wanted to touch upon today was really volume depletion and what role that plays in facial aging. You know, a lot of times people will come in and they'll be concerned about a wrinkle or some textural changes. But what's really concerning them is that they look in the mirror and they might feel like they look tired, or people will say, you know, I kind of look saggy. People ask me what's wrong, and there's nothing wrong. I feel vital. All my hormones have checked out. I went and saw Dr. Levin and everything's good, but I look tired. So a lot of those things are actually caused by volume depletion.
Right.
And to put things into perspective, I brought some measuring cups. You know, we lose about half a cup of volume in our face between the ages of 30 and 50.
Shocking. That's more than I would have thought, a half a cup.
Yeah. So that's both from sort of skeletal losses and also from fat pockets like in our cheeks and temples and other areas in our face. And then when we look at replacing that volume, you know, we use natural products that are naturally found in our body, like hyaluronic acid. That's a jelly-like substance that's in our eyeballs. And then we use calcium hydroxyapatite, which is what our bones are made out of. So we're putting back what's been in our body before.
Yes.
But one syringe of any of these products is really less than that little quarter teaspoon.
Less than this.
Less than that. So when we talk about syringes and so forth, just keep that in mind.
Sure.
Now, treatments definitely have to be individualized, and you know, the placement of the filler is key. It has to be done artfully so that it looks very natural. We've all seen people in Hollywood that it's very obvious that they've been enhanced, and maybe they've just had 1 or 2 syringes, but they've had it put in their lips, whereas the rest of the face might be devolumized, and it's going to look visually awkward. So that's something to keep in mind.
Absolutely.
Yeah.
We have some examples of some of this where it's been done very well.
Yeah, so this is a patient of mine, and you know, her main concern was really heaviness in the lower half of her face and the start of some jowling.
Yeah.
But there's other areas that are devolumized, and we used 12 syringes in this case. And you know, if you look at the before picture, I would say that the emotional impression that you get is a bit of harshness, a little bit sort of difficult to approach, and firmness. And that is actually coming from volume loss. If you know her, she's a lovely person, loves people, very vibrant. And I think in her after picture, that's more reflective of her personality.
She just looks
more attractive and lifted. This is Teresa. You've met Teresa. She's been on our show. Her case was done in 2 separate sittings, and her concern was really tiredness around the eyes as well as a sense of sagginess. And you know, we've used upwards of 16 syringes in her volumization, and again, lifted, less jowling. If you look at the jawline contour, it's improved significantly. And you know, I've looked at post-surgical or facelift results that look very similar.
Is that right?
Absolutely. And so we've done this in the office with no anesthesia, no downtime, and you can return to your regular routine. I've asked Teresa and Crystal what the response has been from their friends and family. And it's interesting that both of them said that people didn't really know, but they just kept commenting that you look so refreshed, you look so well rested and happy, and just, you know, the overall impression is just more attractive.
And that's the key. It's subtle, but it's definitely something that is a positive sign in your face, right?
Yes.
And so with these types of options, do people still get facelifts a lot? Like, are we seeing that still?
Well, the trend is definitely less towards that. Most people don't need, you know, facelifts or surgery. And even if they do choose to have that, volumization is still key. So they'll get fat grafts or other volumization treatments, and sometimes people opt for hyaluronic acid fillers anyway. What I like about these fillers is, yes, they'll go away over time slowly, but again, our facial anatomy changes.
Yes.
So my question to my patients is, do you want something permanent that's not going to change? When you change,
Yes.
it's going to stand out.
Yes.
So we always want to have a cohesive approach and keep everyone looking natural.
Yeah, natural.
Yeah,
absolutely.
absolutely.
It's about aging gracefully.
Yes, and taking control of that process.
Absolutely. Dr. Lotay, it's great to have you back on the show. We are out of time. This is a great example of how you can make these types of things work for you in a subtle but very effective way. So thank you very much for being here. If you have questions for Dr. Harpreet Lotay, sonamd.ca, as well as the phone number on the screen. We're back after a quick break. Stay with us.